All right, back live with you tonight, and thanks for staying on. The National Health Department's budget tabled in Parliament has declined by 4.4 billion rands. Treasury previously acknowledged that the ministry is underfunded by a minimum of 11 billion rands, with the Health Minister warning it could be more. The DA Portfolio Committee on Health member Lindy Wilson joins us now for more on this. Lindy, good to have you, and thank you very much for your time. We heard earlier on in February that extra money for health care would be forwarded, of course, following the cuts that were announced during the time of the pandemic. Have those increases come into effect, and are they making any significant difference?
No, in principle, no, not at all. And in actual fact, we see more and more problems arising. And one of our biggest concern in the budget cuts is that one of the areas that has been cut is primary health care. Now, primary health care is the most critical part of any health care system, and that is the area where we do preventative medicine as opposed to cure. And that is an area that has been cut in a health system that's already in serious trouble. So, the alarm bells are definitely ringing at this stage.
What are the pressure points of primary health care? Where is the biggest need?
Well, I think, first of all, I think what we need to deal with, and particularly at grassroots level, is that hospitals and health facilities are seriously underfunded, seriously under-resourced, and seriously understaffed. You end up then with a situation where people cannot get proper or quality health care. There's not enough people to service them. There's not enough people to diagnose them. There's not enough medicines for the most basic things. And what we're seeing is people getting, more and more seriously ill. And particularly children under 5. 32,000 children under the age of 5 died in the last few years. And some of those from pneumonia, diarrhea, and a lot of them from other health problems. Now these are diseases and situations that you should be able to treat, and yet we are losing children in their thousands to this, and the majority of them are actually dying of malnutrition and starvation.
Yeah. So what we did see certainly is money being shaved off from the health compensation bill, as well as from some conditional grants which have got to do with HIV and AIDS, hospital infrastructure, training certainly, and some posts that have not been funded. What has been the impact of that?
Well, what we're seeing is a very huge regression in the quality of health care. They argue that the health care is there, that the facilities are there. What we are, please believe me, are huge supporters of universal health coverage, not necessarily the NHI bill. But what we are seeing is a bigger and bigger regression in the quality of health care. And the people who suffer the most are those in rural areas, the poorest of people and the most vulnerable people, who cannot get the most basic health care at this stage. And so people are getting sicker and sicker, and they're not getting appropriate attention. And there's massive backlogs in critical surgeries, in some areas up to 7 years. That can't be acceptable.
So we are unlikely, from where you're sitting, going to be filling any of the vacancies that have been reported in previous years. I think it's close to 19,000 vacancies that we are looking at in the health department, largely due to the budget cuts. Absolutely.
A lot, and particularly critical areas in the health sector, critical specialists particularly. There is no funding to create those posts at the moment. And when you create those posts, you must take funding from somewhere else. And this is creating a huge problem. And the other thing is that, doctors, number one, are very wary of working in the public health system at the moment because the medical negligence claims are exceptionally high. Admittedly, a lot of that is corruption. We accept that. But, doctors are wary of putting their heads in a noose. Even if we could fill a lot of those vacancies, you can understand that a lot of the doctors are very, very wary to do that.
Yeah. And if we were to begin filling those posts, I know you're saying much of the attention should be in the primary health care, but which of those vacant posts do you think should be prioritized right now in all the provinces?
Health is such a very vast portfolio. But, I think we're seriously lacking surgeons. I think we're seriously lacking people who can assist with diabetes, people who can deliver babies, because this is one of the biggest problems at the moment, and the highest number of medico-legal claims that we face at the moment are children damaged at birth, which means they're not being delivered properly. That being said, a doctor, no matter how well he delivers a baby, is going to have a problem when there's no infrastructure. I mean, we've had babies delivered by the light of cell phones. That's how bad the situation is.
And do you get a sense that the department is intervening in any way? Are there any interventions that have been introduced? Tell you what, Minister Joe Pasha saying they've introduced several interventions which range from the prioritization of posts in the annual recruitment plan, prioritization of posts for conditional grant funding, filling of replacement posts considered and approved weekly. They are being advertised, published on nationwide print media. Are you seeing any of these things actually happen?
Absolutely not. I mean, if you go to any of the hospitals, and we did an oversight in the Eastern Cape November, December last year, we have never seen such appalling conditions, such understaffing, such degradation of health as we did there. We will obviously go back to double check what's being done there. But any visit to any hospital in the country at the moment in the public sector just shows us that in actual fact nothing is improving. It's going further and further backwards.
If you were to suggest an alternative way, because it seems here the minister is also looking at an alternative way, particularly to fund infrastructure. He says we're looking at alternative methods of funding to increase the pace and the scale of delivery of infrastructure within the timelines without cost implications, of course, compromising the quality. What ideas is the Democratic Alliance suggesting here?
Well, I think principally the first step you've got to take is assess the entire health system as it stands. Assess what infrastructure there is and what needs to be prioritized. Where we can upgrade infrastructure in current facilities, upgrade the staffing, make sure that the machinery is there, that the technical skills are there, and all of those kind of things. So it's a case of assessing the entire health system as it stands, assessing what needs to be prioritized, sorting that out first, and then looking into the rest. So there's a lot of talk about, building new hospitals, and there's one apparently coming up in Limpopo. We haven't seen the start of that yet. But if you targeted your already degraded infrastructure and upgraded those facilities, there wouldn't be such a rush to do the rest.
Lindy Wilson, much appreciated. Thanks for coming on tonight. DA member of the Portfolio Committee on Health. They're pointing out some of the areas that should be prioritized, certainly in meeting the needs of our health sector.